I'd like to introduce Anne Marie Cook, who is the President and CEO for Lifespan of Greater Rochester. We also have speaking today Joyce Strazabasco, who is the Administrator for the Council of Agency Executives. So please join me in welcoming Anne Marie and Joyce.
Thank you so much, Rebecca. And I'm here today not only as President and CEO of Lifespan, but also, of course, as I'm the current President of the Council of Agency Execs. And just briefly, the Council of Agency Execs is a membership organization of not-for-profit executives. We work together to look at sort of the emerging climate of not-for-profits, do a lot of training and education so that we all can be better leaders in the nonprofit sector. So I'm pleased today to join the Administrator of the Council of Agency Execs, Joyce Strazabasco, in talking about the emerging needs of nonprofits in the current economy. I want to start, though, going back. Sometimes for me it's important when we talk about the future and what here is in the present to talk about what came before it. Just so everyone knows, to set the stage, there's about 1.5 million not-for-profits in the United States. And it's really, as Daniel Patrick Moynihan said, I thought this was a great quote, it's really something that's so uniquely to the U.S. to have nonprofit organizations working on community needs through this sort of private nonprofit partnership with government and the community. And so, as he said, most of the time it's sort of singular issue in which we have these passionate people creating these organizations, nonprofits, to help in the community. Now, Center for Governmental Research, I don't have this on, did a report several years ago and said there's about 6,000 not-for-profits in the greater Rochester region. I have to sort of give you some context to that because it's a huge number of not-for-profits. Most of them, I have to tell you, are the Little Leagues, the Pop Warner footballs, some libraries. There's about 300 to 400 nonprofits that deal with human service needs in this greater Rochester region, you know, of the 5-county, 6-county area. So when the Council of Agency Execs primarily is talking about the human service needs in our community. Just, again, a little background, the Community Chest was really what started the nonprofit world, and in 1919, we got the Community Chest, sort of the forebearer of the United Way, brought here, of course, by George Eastman, who brought together so many sort of things in our community to help nonprofits. And really, the Community Chest was for human service needs, as I talked about. Talking about all of the needs of individuals. In most of the nonprofits, the bigger nonprofits deal with health, education, children, families, those kind of nonprofit needs. Nonprofits not only help, of course, with individual needs, but also I call them the voice for the voiceless. And there is a big surgence of not-for-profits in the 40s and 50s, and then again in the 70s and 80s in our community. Joyce.
Before I continue the prepared remarks, I just wanted to say anybody who wants to ask a question at any point, just let it be known or make a comment. And I'm curious to know how many of you, just by a show of hands, are in some way associated with a nonprofit. So we're preaching to the choir. I had a hunch, especially in Rochester, which you know, if you've been anyplace else, is particularly rich in nonprofits. We went to Buffalo a lot. Well, my in-laws were aging. And there came a time where my father-in-law really needed medical motor service. And I said, well, where's medical motor service? They don't have it. We're just so used to having things available for our needs. And right down the road, they didn't have it. So the tone of the debate changed. And actually, Anne Marie, if you want to talk a little bit about that one.
So I set the stage of how not-for-profits developed in this country, and as I said, you know, a lot of not-for-profits popped up in the 40s and 50s after World War II, and then again in the 70s and 80s after President Johnson declared the war on poverty. So all of a sudden you had a lot of not-for-profits popping up, talking about how are we going to solve sort of these human service needs of the community. But the tone definitely changed in the 1980s, I think for a variety of reasons. It became more of people need to pull themselves up by their bootstraps. It also became to light, of course, that, you know, government regulations began to regulate not-for-profits more and more like businesses. So we talk about non-for-profits, a lot of unfunded mandates, just like businesses talk about today, because government started putting unfunded mandates on not-for-profits. Run more like a business. We're going to regulate you more. You're not sort of out there as just good, passionate people. You're a business. And of course, not only sort of did that happen, but then the big sort of change, I think, for not-for-profits hit after 9/11, after the economic downturn. Then we started to see huge state and federal cutbacks in not-for-profits. So not only were we facing sort of more regulation, more business practices, but also huge hits to sort of our bottom lines and our funding streams. And, you know, to add to the mix, we had increased costs just like everybody else did, just like you do. Increase in health insurance, increase in staffing, increase in technology needs. So all of a sudden, but before, when we were so focused on the individuals we wanted to serve, we had to change that because we had incredible pressures, business pressures to operate non-for-profits. And our community, as I said here, was also changing. So we had this changing not-for-profit world. We had this changing business climate right here in Rochester. We know what happened with Kodak. We know what happened with B&L and Xerox and the big three. So all of this was in the mix as you take a look at as we set the stage for what is happening to not-for-profits now and our emerging needs.
Thanks. We see in this new environment United Way funding greatly reduced for a lot of reasons. There was a time when United Way, I think, met most of the human service needs, at least for which there were organized services. But the number of agencies has continued to grow, and what's been happening to the United Way campaign result, it's declined. From a peak of $38 million, it was, what, $28 million again this year? Yeah. Which is a huge amount of money not to have to distribute to the agencies. So they've had to get a lot more focused in how they hand out money, and agencies have had to be a lot more prepared to do fundraising. When I first entered the not-for-profit world back in the 70s, most agencies did not have development directors. Now most agencies do, at least the larger ones. And it's often, even in a smaller agency, one of the first things they try to get a staff to do, because it's so much more needed today in this climate. The flat and decreasing government funding, which we anticipate will continue to be less as the federal government and the state governments and the county government, to a lesser extent, all deal with the accumulated deficits that they have, not to mention those that run in annual deficits from time to time. So looking to government for more money is not what we're really doing today. From all of that, we've got the increased need for services, especially we've seen as the economy got worse. The soup kitchens had many more customers coming to them. The clothing stores that sell at a lower rate were having a lot more people going to them. All of our agencies were reporting higher service needs, but fewer dollars to meet the demand with. And that's frustrating and difficult to operate in that kind of environment. Excuse me. And during this time, the number of people receiving temporary assistance increased. And we know that Rochester has the highest rate of childhood poverty. Is that in the nation?
In the state.
In the state. Which, alongside of the wealth that resides in this greater Rochester area, is kind of a befuddling pair of facts. The rate of residents receiving emergency food assistance increased 105% since 2000. Those are basic needs. Those of you who studied sociology, the Maslow hierarchy of needs, bottom line, food, clothing, shelter. And people are in greater need for those things. So what are agencies doing? They're cutting programs, cutting staff, cutting benefits. They're sharing services. Sometimes a couple of agencies will share a technical person, a computer person. They outsource. A number of agencies are outsourcing human resources or financial management. And as always, they are collaborating and partnering and affiliating and merging. The United Way has encouraged restructuring for 20 years and always had a fund to assist with that. In 2007, they focused it a little more, renamed it the Synergy Fund after our Synergy Committee. And since that time, they've assisted financially 22 affiliations. Not all of those were mergers. We had an affiliation just announced last week with LDA Life and Learning Services and the Advocacy Center, combining as an affiliate in an affiliate relationship, expecting over the next year to merge. Excuse me. And sadly, one of our members went out of business. The Career Developmental Center started as the Women's Career Center, went out of business 2 years ago, could not make it. We hope that more positive outcomes can be achieved than the whole thing going down the tubes. Hopefully, someone somewhere can find a way to blend with the services so that the needs that that agency was meeting can be met in a different way, maybe by a different organization. The needs are there. So what are we looking at ahead? More financial difficulties, I believe. More state and federal cuts. At the same time, more partnering, more teaming, collaborating, sharing services, and merging. There's a whole collaboration continuum that we talk about a lot at the council, from the very gentlest of collaborative efforts to, at the other end, merging organizations. And in between, there are many, many opportunities to come together, to share resources, to work together to sustain the services that are needed. I think we'll see a lot more aggressive fundraising. As I mentioned, many agencies now have development directors. That means you're getting hammered with more campaigns. The whole beauty of the original community chest was that there would be one ask. And no one provider can claim to meet all the needs that exist out there and the many, many organizations that have services addressing those needs. So you'll still be getting the envelopes in the mail. And we look at different ways to measure success. More we look at outcomes rather than just passive services. We have to be putting our financial support behind the things that we know work. And that has been a challenge because sometimes proving that something works takes a very long time. And we don't always have the long-term data that is needed. Just a little extra challenge in our sector. Something that is very exciting is the notion of social entrepreneurship, which is having a business, excuse me, that may employ people that an agency serves, or provide services that pay for themselves, and or is absolutely a profit center that feeds the host agency. And you're seeing different examples of this. Long time we've had the Goodwill stores, the Volunteers of America stores, the profits from those help the services of, in the case of Goodwill, the Association for the Blind. In the case of VOA, it's their other services and ministries through that organization. East House, which serves the mentally ill, a year and a half ago, I believe, opened a cookie shop there on South Avenue, Monroe. Good cookies? Oh, darn good cookies. And I don't know how they're doing, but that's one of the more recent efforts. And you can be sure that even though there are many, many nonprofits already, there will be new ones cropping up. Because in this town, when somebody gets an idea, they start an organization. At the council, what we're committed to is sustaining the services needed by our most vulnerable citizens. We are not necessarily committed to sustaining agencies. We're committed to sustaining services. There may be a difference. And we're looking for achieving synergy wherever we can. If you're not familiar with that term, synergy is when the whole is greater than the sum of the parts. So when people come together to do something, and together they make something better than either of them could have made individually. And we look to building partnerships as we can to accomplish those things. This was kind of a broad overview, and hopefully it spurred some thinking in your mind, or some challenges, some questions, whatever. What do you got? Yes. What would be some examples of success of the Council of Agency Execs? You mean with respect to agencies collaborating? Mostly what we do is, as Anne Marie said in the beginning, educating and strengthening leaders. And I think we've put on some doggone good programs that have helped people understand their role better and hopefully perform it better. There was the first program that we gave on the collaboration continuum was in 2007, I believe. And as a result of that program, a little tiny agency that had struggled since the day it was born merged with another agency when they realized that they couldn't make it on their own. So that struggling agency now lives in a larger agency and has a home and a future. I'd say we had a tiny hand in that. Yes.
Do you want me to take it or you want to?
Take it.
So I think everyone heard the question is, does the good work of the not-for-profits hold back sort of what government should be doing? Is that correct, what you're saying? I mean, I'm going to tell you my opinion, and I think everyone has their opinion. I love the structure of the nonprofits handling human service needs because I feel like we have a flexibility government doesn't have. And I always see working with government in partnership. And I'm, again, speaking for myself, I work very closely with every level of government to solve issues because I do see it as a partnership. They have a role, but so do we have a role. And I think that the flexibility of the private not-for-profit world allows us to solve problems better. I mean, certainly there's that debate going on, but this is the structure, as I talked about in the beginning, the background of how nonprofits grew in this country. You know, we've chosen this sort of private nonprofit community. That doesn't mean we should let government off the hook. It means we have to work in partnership with them.
And as it happens, we can do things, the nonprofits, can do things less expensively than the government can. So the money goes further in our hands than it does in government hands. And that's borne out when you look at addiction services, when you look at the Office for People with Developmental Disabilities. Hands down, we're more efficient and we believe more effective. Any other questions? You know, the one thing I didn't do, well, I'll take your questions. I never mentioned some of the collaborations too, but I'll take you first and then you. Yes, Jim? So the question is, where are the collaborations on the functional level? Fundraising, HR, finances. And they happen in a couple of ways. One way is outsourcing, purchasing services from an organization that provides just that. And one of the first ones to crop up and become very successful were the payroll services. I mean, there was a time when everybody had to write their own checks. Nobody does that anymore. Everybody's got Paychecks or ADP or somebody else preparing their payroll. Similarly, people are outsourcing human resources. One reason, it is so complex with regulations that it's hard for a small organization to stay current with that. So to the extent that they can, they outsource that. Some agencies that do similar things do look into sharing what they call back office services, and that's just the administrative, operational things like, finance, production, internal production of things, documents, and so on. And there is a collaborative called Recovery Net, which is a group of 10 to 12, I believe, addiction treatment and recovery providers that came together at least 10 years ago, maybe more, to begin to meet the needs in the community more effectively together. They ended up, one of the things they've done is consolidate the patient records so that, people move around in the community from provider to provider sometimes. And this way, the record is a common thing wherever they go. They also computerized similarly. They got the same data collection software. And here, there were partners within the collaborative that couldn't afford the software. And those who could got a grant so that those who couldn't pay for it would have it. So there are ways that people have been working together. And there will be more. It's like anybody. Nobody likes change. And you change something when the pain of continuing it overcomes the fear of changing. So some of us are slower. I always used to say, the only change I like is change I initiate. And I don't even like all of that. But as we become more strapped and stressed, we have to find more and better answers. But as for me, I'll always be saying, keep your eye on the services. That's what's important, and we have to sustain the services. And you, sir?
I was going to say it's both. It's what you said in terms of volunteering, and I'll just give you a small example from my own organization. Lifespan employs about 120 people. At any given day, we have 300 volunteers working with those 120 people. We have a huge volunteer base that help us do our work. Second thing is, as Joyce said, we unfortunately pay people less, but also it's not only paying people less, we don't have the pensions that, you see government pensions have. So, they're on the hook not only for that employee today, but for 20 or 30, 40 years after they leave government service. The gentleman asked if, there's a clearinghouse in which someone has an idea, then they could come and look at the clearinghouse and get connected to an organization that does a similar issue and what they're interested in. And I know Joyce and I have both had people come to us with exactly that. So the Council of Agency Executives informally does serve that role. And I've had a lot of people, I'm going to be honest with you, come to me with an idea, for an aging issue, because that's what Lifespan does. And I'll say, well, instead of starting your own organization, let's work together. Sometimes that works, and sometimes the person's so passionate, they go through all of the paperwork with the state, which I'm going to tell you, it's pretty easy to start a not-for-profit in New York State. It's really hard to dismantle one. Joyce talked about how Career Development Services unfortunately went out of business. They're not actually officially out of business yet. It's still hung up 2 years later in the state trying to dissolve it. I talked to the former executive director. So I think there's some laws that need changing in terms of what you said. We have a lot of not-for-profits. So I think we need to make it a little more difficult on the state side to actually create them, and maybe giving us an idea where we more formally serve the role of vetting new ideas to help connect people.
I just want to add a comment, and echoing some of what Anne Marie said. You can appeal to people to do that, but the response is, but mine is different. Mm-hmm. Mine is different. And a while back, Peter Carpino spoke with the Synergy Committee of the Council, and he said something in that meeting that I have repeated over and over, because it's a real important thing for people to think about, and it has to do with too many nonprofits, too few attempted affiliations. He says the problem is with the board. It's with board members who are acting more like owners than stewards. And nonprofit board members are stewards, not owners. But when you're with something for a long time and it becomes a big part of your heart, it's very hard to change. Okay, that was a twofer. One was we gave the Walmart response for why we can do it more effectively than government, and it was a bad response. Because it's true that we pay less money, and we provide an environment where people are willing to work for less money because they believe in what we're doing. And it's unfortunate that sometimes we have to make a choice. But when you hear of abuses in places, it's often a state-owned or a state-run facility. I'm not going to get off on that. And the other part of the question was, how did the faith-based initiative that under George Bush affect nonprofits? I'm not aware of any effect. Are you?
No, I'm going to be honest with you. When we were doing RFPs at that time, and it really did end after George W. left office, we had to check a box if we were a faith-based organization. I assume those organizations got, additional points during those years, but it really quickly ended after he left office, and I don't know of any organization that felt that they were negatively impacted as a result of that. And I also want to echo, I do feel bad, you're right, we gave a Walmart response. I'm really much more proud of our outcomes that we're able to achieve as a result of, I said, that flexibility we have, more so than our cost.
Okay.
I'll try to answer these really quickly, and Joyce, I'm sure will jump in. You mentioned benefits. As a council, Joyce surveys the members every year, not-for-profit members, about benefits that individuals are receiving and try to rank them. We all use that information. Certainly what I have seen is a couple of things. One, pension contributions have been one thing that agencies have been able to adjust through the years and have adjusted. But as a council, we're trying to do a lot, looking right now at a healthcare collaborative in which how do we all purchase healthcare insurance together. There's a lot going on in benefits. You talked about evaluation. And it's absolutely true. Almost all of us have had to change our practice to either do evidence-based programs that have already proven to work or strong evaluations. I know at Lifespan we have partnerships right now with the University of Rochester, University of Chicago, Cornell University, an outside evaluator looking at our programs all the time to tweak them with those evaluations. It's very exciting because then you know they're truly working from an outside source. I forgot what you said on so many things here.
Sponsorship was a comment. Yeah. So, yes, and I think that was more a comment than a question, too. Social media is an added expense and stress. This lady back here, last one.
Yeah, the comment was, in terms of health insurance, everything is changing, and certainly it's been proven that Medicare is a very efficient system in terms of delivery of health care, and same with Medicaid, and now we have fights between the state and federal government. I will tell you that the last talk I did was 2 hours on the changing health care environment, so it would take me 2 hours to respond, so I'm going to leave it at that. That's right.
I'm willing to stay a few minutes if somebody has an additional question. And I left a council brochure and my card on the deck.